Okay, hello everyone. This is the Champaign County Joint Information Center news briefing for May 28th, 2020. As always, I will turn it right over to Champaign-Urbana Public Health Administrator Julie Pride for some local updates.
Hi, good afternoon. As of yesterday, we are 583 cumulative cases of COVID-19 reported. We have done in our county 12,874 tests. Right now we have 142 active cases that are in isolation, 6 hospitalized. We're currently working 26 outbreaks, 4 in long-term care facilities, 2 in congregate living facilities, 8 in restaurants, 8 in manufacturing, 1 in a hotel, and 2 in outdoor construction sites. So with that said, as we move into phase 3, I just want to remind everyone that just because more things are opening up does not mean that the virus is gone, or that people should stop doing what they've been doing, namely social distancing, remaining 6 feet from anyone who is not in your household. That has to continue, as does wearing masks and frequent hand washing. This is going to continue throughout the entire pandemic, and I've seen a lot of information out there indicating that people think that with this being lifted, that it means that everything is okay and they can just kind of let down their guard. But it's very important that people remain vigilant, continue doing those things, and even though you can go out to places like restaurants or more retail shops, you have to remember that those guidelines and rules are put into place to protect the employees as well as to protect our community, so that we don't slide backwards by having a lot of outbreaks. And we just want to make sure that everyone remains safe and healthy. Thanks.
Okay, thanks, Julie. Next, we'll go to Champaign Mayor Deb Finan.
Hello. So I thought it would be nice to let people know what we're doing with the soft opening or reopening of our bars and restaurants. We have a 3-phased plan. So we are allowing for some expanded space in the existing sidewalk cafes. We are creating some picnic parks in our downtown, and we are allowing for private businesses to use private space like parking lots in order to have outdoor space. It is, you're going to need a reservation at the businesses in order to be seated, so keep that in mind. Part of that has to do with keeping names and phone numbers for contact tracing, which is something Julie can really speak to. She issued some protocols. But I want to mostly remind everyone to be patient with your servers, to be patient with other patrons, to not get frustrated as we ease into this reopening. It's going to be challenging for everyone as we figure out how to do this. The city will be having an internal meeting on Monday to see how the weekend went and what tweaks need to be made, and then we're meeting with our license holders on Tuesday. So I expect that we will continue to revise our ordinance. We will probably allow for some additional hours and some, additional easing of our restrictions, but we want to go in slowly to make sure that everyone can maintain safety, safe distances, hand washing, wearing your masks when you're not eating or drinking.
Okay, thank you, Mayor. Next, Urbana Mayor Diane Marlin.
We're basically doing in the same mode as Champaign and other communities, which is getting provisions in place to allow for outdoor seating for bars and restaurants. It was just about a week ago that the governor's office notified us that this was going to happen. So we had about a week with a 3-day weekend in between to get all this into place. And staff has been just doing a tremendous job. So we, like Champaign, we are providing more flexibility for outdoor seating. We're allowing the use of public parking lots in our downtown, expanded use of private parking lots, waiving parking requirements, expanding the existing sidewalk cafes, and allowing for more use of our sidewalks, provided that pedestrian traffic and distancing can still be maintained. We have an outdoor seating permit application, and process is all described on our website. It's on our homepage at urbanaillinois.us. At this point, I just received word, we actually have 12 applicants for these outdoor seating permits, and it's a combination of our bars and restaurants. And as I should say, the parking lots involve and sidewalks involve both private and public property. And as our other speakers have said, the focus is on public health and safety. So we're asking people, you know, what their plans are for trash removal, for distancing, for sanitation, for restrooms, how to accommodate waiting patrons, and contact tracing is very important as well. So we are doing a phased opening. We've gotten a lot of questions about music. Live music is not allowed. At this point, all our efforts and energy has been spent on just getting the businesses reopened safely. But we do intend to consider music in the coming days. We know how important it is for the community and for the businesses and for the the creative community. So that will be our next area of focus once we get people up and running. And the application process is ongoing. So we do have some people who want to open tomorrow, and we have others who are planning for a week from now or 3 weeks from now. It's up to the business to what they feel they can safely do to accommodate their customers and their employees, and they are taking their employees into account as well. So we're working as hard and as long and fast as we can, and we just hope people can understand and have patience for our staff as we work through this.
Okay, thank you, Mayor. Yeah, it sounds like a lot of time and effort went into that throughout our entire community.
You cannot imagine.
Okay, so this is the point at which we can go to questions. I only have a few people on my list here, so I'll just go down my list. Christine Herman, if you have a question.
Yeah, Julie, can you talk about what the mayor's mentioned about reservations at restaurants and how that will help with contact tracing?
Yeah, so normally if there were to be a positive case that was identified then during the contact tracing, they said they were at a certain restaurant, it would be very difficult for us to, or for them even necessarily to know maybe who they might have come in contact with. So at least if we have the table, the grouping of the table and the time frame, that will help us a lot. And the contact, they'll have collect the name and they'll collect the name, a phone number for the individual, and then the grouping that they're sitting with. So that will speed things up greatly if we were to get a positive case. And then of course the restaurants would be able to tell through their own processes who might have served that specific table, so that that person could get tested as well.
Oh, sorry. And is the main goal with that to be able to contact employees who may have been exposed? Because ideally with the 6 foot spacing, other customers shouldn't be exposed, although that could still potentially happen through perhaps like using the bathroom or
right, things
like that.
Right, and that is what, and when we do the interviews, the case investigations, for example, we would say to them, let's just take an example of a restaurant or a bar. We would say, we know that you were at a table with 5 other people. We will be contacting them to offer them testing and put them in quarantine. Did you happen to do anything else while you were there? Were you at any point standing in line or in the restroom with somebody, which hopefully they weren't? But any number of things can happen, and it will just make sure that we're able to cast the net wide enough without having to go and say, we need everyone in this who might have sat by table 5. I mean, who would know what that is? So chances are, yes. I mean, the goal of the seating arrangements is that only people at those tables would be potentially exposed to the other person. But I really think the way it's being done, if people remain, if they come in, they make a reservation, they come in, they sit at their tables until they're done, and then they leave without any type of crowding or any type of gathering, that shouldn't be a problem at all. It should be contained to just not only that individual, themselves, but possibly just the very few people in their group at the table.
I wanted to also ask, as more people are returning to work in phase 3, do you know yet if the COVID-19 testing criteria will loosen to allow those employees that will just now be returning to work to also qualify for testing, even if they're not showing symptoms?
Yes, they are. Anyone who's working will be allowed to get the testing. So with or without symptoms. So that right now we're testing everyone who's working currently that wants to be tested with or without symptoms. So it will expand as more people go back to work, then those people will then be allowed to go as well. So,
Julie, we have capacity, don't we, in our testing right now?
Yes. We do. We're very lucky in our community. We have a combination of, Francis Nelson has testing, Christy. Carl has the drive-through. We have the community-based testing site out at the mall. We have Campus Town. We have all kinds of testing capacity in our community. So it's not a concern for us right now.
And regarding
expanding.
Yeah, I see. And about that, I tried to get some clarification on how frequently should people get tested if they are eligible for testing because they are in, a public facing job. What guidance do you give to people about that? Like, it should weekly or every 2 weeks?
We do not have any specific guidance on that right now. Now, in certain places like long-term care facilities or congregate living, we have offered some basic testing guidelines of every 28 days. That's not ideal. If we could do it, if we had some kind of little simple test, which I assume we will at some point get there, it could be a simple saliva test with 15-minute results. We're just not there yet. So what we have is what we have, and that's what we have to work with. But ideally, everybody, if we had some kind of effective and fast and inexpensive testing, people could be doing it, every day. Well, let's say this, every day that they could have potentially had an exposure.
And just to clarify, people who have insurance, like their insurance will be billed, but there shouldn't be co-pays affiliated with it, and those without insurance should be able to get access to free testing. Absolutely.
And even though the one at the mall says that you need a driver's license and, put your card up there, if you do not have a driver's license, that is fine. They're just doing that to try to get accurate information to help us when we do the, when they contact them, if there's a positive result or a negative result, and then when we contact people, if they're positive.
Thanks for that.
Mm-hmm.
Thank you very much. Haiti Clotter, I have you next.
Thank you. So these first questions are for both Mayor Finan and Mayor Marlin. Can you just talk about, what the atmosphere is like knowing that we're moving in this direction with things opening back up in phase 3 for tomorrow? And what challenges, if any, will there be, and how will you handle that?
Well, I think the atmosphere is one, it's a mixture. It's relief, it's anticipation. There's some, concern, and we still have a lot of unknowns, but I know for our, and it's not just restaurants and bars that are getting outdoor seating tomorrow. There's a lot of retail, there's a lot of different business sectors that will be opening up slowly. And it's not all gonna happen at once. People are being very cautious, and I appreciate that because I think they're weighing a lot of factors, which includes safety for themselves, their employees, for their customers, and that's a good thing because a gradual reopening is going to be much easier to manage. But I think there's hope. There's some hope out there, and there's relief, and there's and I think in some part of the community anyway is very excited to have a few more options.
I would say as we go into this next section, next phase, I would just re-emphasize patience and kindness. Whether it's with your server at a bar or restaurant, or it's the patron in the seating next to you, or it's the retail shop that maybe doesn't do things exactly the same way that they used to do it. We are all going to have to take turns and wait. You may have to wait in your car. You may have to wait outside. If you forget your mask, you may have to wait further away from people than you would if you had your mask with you. We're just going to all have to take it slowly, and things won't be perfect. And, you know, I think we have to meet everybody where they're at and not have, you know, expectations that everybody can do it the same way that you might think that you want it done. And, you know, like Mayor Marlin, I would say there are people who are feeling some relief at being able to move a little bit more freely around town and to enjoy what our community has to offer. But with that really does come the reminder that we are all one community together, that, you know, it's not always just about you, but your actions impact everybody right now. So, you know, wear your mask, wash your hands, social distance, and try to be patient.
Those four things are the key to success of any kind of reopening, because we could be right back where we were 2 months ago if we're not careful. So, you know, I would say don't make people ask you to wear a mask, just do it, and wash your hands and respect the distancing that you're being asked to do.
Yeah, and you know, I have to say we have gotten a lot of complaints from people who are out there working. You know, we have people right now being infected at their jobs, working in public-facing jobs, and you know, they don't need to hear your philosophical opinion on why you should or should not wear a mask. They don't need to hear anything about that from you. These are people whose job is to, you know, oftentimes businesses are putting people out there specifically to make sure that you're coming in with a mask to protect their employees and their staff. Put the mask on and give them a break. You know, they don't need to hear from you. That's being rude, and that it's not, do you actually think that it's that person's, that person has anything to do with this rule, or that they have anything to do to change it? So, you know, give them a break. If you don't want to wear the mask, you don't have to go into their place of business. So don't take it out on the staff. You know, they're trying to do things, they're trying to open things, or even like the grocery stores and the restaurants that have been open. They don't need to hear your opinion about this. That's not helpful at all. Just, you know, do what you're asked, please follow the guidance, and let's make this as safe as possible for everyone, because this is a long-term thing. Wearing the masks and doing the social distancing. And I do want to remind people that when you go out, if you sit in a group that is not your household cohort, that does risk infection. We all have to still assume that we are infectious and that everyone out there that we come in contact with is also infectious. So, you know, just keep that in mind when you're doing that, because if you are someone who then may go back and have contact with someone who is the high risk, that is something you need to consider before you go out with people other than you're used to being around all the time.
And Julie, my next question for you, as things start to open back up and people will be going out more, what does that mean as far as cases in the area? Do you expect them to rise significantly?
Yes, we actually do. Just because we have seen this many outbreaks right now with the with the types of places that are open, we do expect to see cases go up. Again, we have a really strong testing and contact tracing program in our county. So hopefully we can get right on top of them. You know, we get everyone contacted and put in isolation or quarantine within 24 hours. So hopefully we can keep those down. I do want to caution anyone who is at risk that you need to be very thoughtful about whether you want to go out somewhere where you might come in contact with people. And also, if you go somewhere and they're not following the rules, you know, don't call the mayors, don't call me. The first thing you should do is to talk to the management, because they're the ones that have a real vested interest in keeping their employees and their business, you know, safe and their business open. So talk to them first, and then, you know, that's the main thing. You can talk to them about you know, what they're doing there, and that will be more effective than not saying anything and then trying to report it later. And the other thing is that if you go to a place, whether, of course, it wouldn't be in Champaign County, it would be in another county, but let's say you go there and they're not doing things properly, and you see a crowd, you see lines, you see bunching up, you see gathering, just walk away. Do not risk going into that. Just go away from that, because that is important, that is risky, and just because they're doing it doesn't mean that you have to be involved in that. So, you know, really constantly assess your own risk and those that you may be around outside of your restaurant or whatever, wherever you're going. But Champaign County is doing it correctly, I will say. I have been super impressed with the guidance that has come out, and the restaurants and the bars and the retail and everybody has been working really hard, and it looks like it should go really well. But as people do get out, we are definitely going to see more cases. I mean, that is the nature of the beast.
Thank you.
Mm-hmm.
Hey, thank you, Haiti. We'll go to Pam Dempsey next for questions.
Hi, thank you guys. This is really great information. Pardon me if you've already answered this, but so there's guidance on the reopening. This is addressed to both mayors. How do you in Urbana, you guys are not allowing live music. Is it something you're allowing in Champaign? Like what's situations like that? How are decisions made? Is it still coming down from overall guidance, or is it up to you guys how you're implementing some of that?
Well, we are separate cities, and we do things a little bit differently, but I can tell you that my new best friend, Diane Marlin, and I talk to each other almost every day. We really have, I joke, but we really have been working together to try to provide consistency across Champaign and Urbana. It's much like the violence prevention work we do. The gun violence doesn't stop when you cross Wright Street. The virus doesn't either. And so we are trying to coordinate in a way that people can have consistent expectations across cities. We have a little bit different issues because we have, different kinds of businesses in Champaign or Urbana, or different volume of businesses, but we're working hard to work together.
I mean, the most recent example of that was our joint policy on large-scale special events that came out, was it last week or the week before? The music decision will be forthcoming. It's just, as I said, it took all we could do to get things in place to allow for the reopening itself. And it's not just a simple matter of setting tables out on the sidewalk, although I think that's what people sometimes thought that was. It's incredibly more complicated than that. And so we focused on supporting the business and making sure we gave them the flexibility to be able to do outdoor seating. And then we'll look at some of the other niceties shortly.
Sure. Thank you both. So Champaign, are you also postponing the live music?
We are allowing for, I believe, some piping of music out onto the street to the seating area, but we don't have a provision at this point for live music. And some of that just has to do with space. We're trying to allow for as much space as possible for seating. And we need to be able to socially distance. So, the live music presents its own set of challenges, which we haven't even begun to address yet with Julie, who's nodding as we talk. So, you know, we'll get there, and I'm sure that we will have conversations with Urbana as we move forward on that.
I think we'll try to be as consistent as possible across the border on that one. And it's not just live music, is it amplified music? Is it acoustic? What's the impact on the neighborhood? Because we are using some spaces that typically aren't used for outdoor anything. So we have to be respectful of the neighborhoods around some of these venues.
And that's true with lighting as well.
Yeah.
We have asked our venues to be mindful. Even the sound of voices carries on a warm summer evening, and we are allowing people in spaces that you normally wouldn't have them. So again, it's patience and kindness. Neighbors are going to have to recognize that the streets may be a little bit louder, and we would ask patrons to also be respectful and not be shouting while they're outside.
And I always have to be the buzzkill in the group, but you know, one of the things with having loud music, or even if it's amplified or whatever, is that you have to yell to talk to each other. And when you yell, it causes more breath to come out, it causes potentially more virus to come out, and it causes you know, the likelihood of infection if it's present. That is why, you know, singing and yelling and anything like that, actually anything that causes that.
And it also encourages gathering and contact, and that's something we have to take into account as well.
Yeah, music plus alcohol often equals dancing.
Really?
I'm going to quote you on that, Julie.
It'll be on the t-shirt, right? So couple of more questions. Secondly, enforcement. So I understand, you know, as Julie brought up, you know, if you see somebody not wearing a mask, this is where you should go. Is there any type of enforcement around some of this? Or is that like a whole separate issue to be addressed later? I'm just curious.
Well, I mean, not necessarily from our point of view. I mean, it would, you know, we would probably discuss it with the business if we're getting complaints, but we always urge people to talk to the management first, because something could be going on that they don't know about. And the vast majority of things, they get taken care of like right on spot immediately. Whereas if you just sit there and you know, stew about something and then call us the next week or something, then that's when we're going to get to it. So it's better just to try to address it then, because the idea is not to punish people or, you know, get people in trouble in any sort of way. The idea is to make sure that it's everyone's being safe. So sometimes that will just be a matter of letting the manager or someone like that know that whatever the issue is that you're concerned about. And we urge people to do that with restaurants and places in general. I mean, you know, we'll get calls about stuff and we'll say, well, that would have been ideally reported to the manager at the time and taken care of so that no one else would have potentially been at risk.
I mean, one of the reasons we
soap in the bathroom, for example, if there's not soap in the bathroom, tell the manager. Don't wait a week and let everyone there at the restaurant go without having hand soap. And
don't call the mayor's office either.
Don't call the mayors either. They don't care.
Well, we care. We care.
We don't want the call.
No, one of the reasons we were
come out in the plague mask. I will point my stick.
One of the reasons we were so thoughtful about the guidelines that we set up for these outdoor dining areas is that we tried to put enough things into place for and the governor's directive was actually very, very detailed as well. So there's a lot of structure built into this outdoor seating area process, but we do not have the capacity to enforce mask wearing and social distancing. Our police department for sure is not going to be enforcing, it just doesn't have the capacity to enforce that. This is a situation where we depend on the community acting collectively to keep each other safe. And there's no other way around it in a situation like this. And that's what's going to keep us all safe.
So finally, how are you feeling about the reopening? I mean, you guys have all worked so hard to prevent, more spread, and just thinking of the past 2 months. As Julie mentioned too, you're anticipating more cases, a rise in cases. Generally overall, how's everyone feeling?
I'm feeling hopeful that we will do a good job in this county of just exactly what they said. Maintaining the social distancing and the mask wearing, and doing this safely. I always want to stress with employees going back to work too, that you have to remember that you're not only going to be getting exposed by possibly the customers coming in, you can also get exposed and infected by your coworkers. So it's important to not go out on smoke breaks together, or on breaks together, or on lunch together, or anything like that, because you are not unless you happen to be in the same cohort or household. Don't do that, because that is where we're seeing a lot of spread. If you get several of the employees at a small facility infected, they could have to close down just by the fact that they won't have enough employees to do the job.
Well, just like we were very careful in the early stages of this to stay at home in order to avoid overwhelming our healthcare system. Now our next job in this reopening phase is to make sure that every person in a hair salon, or a server in a restaurant, or somebody waiting on you in a boutique is a frontline worker. And if you aren't respectful of them and adhere to the guidelines, you're putting them at risk, which, as Julie said, puts them at risk and in danger of not being able to stay open as well. So we have to realize that our actions directly affect whether or not this reopening will stay open, whether things will stay open.
Yes, because our goal is always to maintain the healthcare system from becoming overwhelmed. So as long as that remains okay, then we should just keep chugging along.
Thank you.
Hey, thank you. We're just a little bit over our time, but I do want to make sure I get to everyone on our list. So the last meeting participant I have here is Laura Blyle. So Laura, if you have a question, you have the floor.
Thank you. Hi, everyone.
Hi, Laura.
Hi, Laura.
This is the first time I've been able to make one of these, so thanks for what you do. I actually have a question about playgrounds. So this is probably directed towards Julie. I hear from parents all the time, when can my kids use the playground? So I don't know what directive you have and how that, and so, because I see lots of different information floating around out there, so I wanted to get it straight from the source.
Yeah. Okay, so let me explain to you, because I know it seems weird to people, why can't kids play together on the playground? And we get, well, if they're together in a daycare, why can't they play in a playground? So the reason is, let's just take Hessel Park, for example. They have that nice big place out there, or Meadowbrook Park. If we end up getting a positive case in an adult or a child who was out there, we're not going to be able to know who was on that playground equipment. With the restaurants and things, we have, and the shops, there's a reservation system, so that helps us to do that. When you have any type of public playground like that, kids are going to gather, and they're not going to social distance, because kids don't. That's super hard for kids to do unless they're being watched like every minute. The other thing is they would be getting, kids are germy, so they'll be all over that, and it would just be absolutely impossible for us to be able to round up all the kids who might have been infected. And that's the key to the contact tracing, is to make sure that we're able to get anyone who was potentially exposed and offer them testing, and then put them in quarantine to limit the spread, because it can get out of hand really quickly. So that's why I know it is very frustrating for people, and believe me, I hear it. But that's the reason why. It has to do with, time and distance, and being able to contact everyone should we need to. Now, if they're, obviously, so it's not something about just the playground. People can play on playgrounds in their own yard, or play equipment, I mean. But and even I suppose if somebody had a playground in their yard and they brought another kid over there, which we wouldn't advise, but if you did do that, at least that you would know who that kid is. You would know who was there playing on the equipment. With public playgrounds, you cannot do that.
Is there a phase in which this would be lifted? That's the other question I see. And lots of people pretending to be experts on the Restore Illinois plan.
Well, okay, so, and I've said this, and it's been wildly unpopular, and somebody quoted me and put it all over Spot in Champaign. But here's the deal with that. That's not going to change moving forward. As we open things, it doesn't mean that the virus is going away. The virus is still there. We're just expanding capacity to be able to deal with stuff. The playgrounds, I don't know how that would, I just don't know how that would work unless there was a way to, like, I'll use the example, there's a park, the little playground in Westside Park. It has a little fence around it. So in theory, someone could stand at that gate and let in X amount of kids and keep track of them and clean between little groups of kids and try to urge them to stay away from each other. There's some buzzkill right there. There's some, there's some fun killer, but so it is, there are things that are possible to do, but the question is, you know, who would be doing that? Do the park districts have the staff to be able to do that? And it just seems like this may be the summer to look for alternative things to do. And there are lots and lots and lots and lots of parks out there, you know, with it. Of course, if you have kids and they see the playground equipment, then that's a problem. So you might want to take them to the other side of the park to prevent them from just pestering you to death about it. But that's really what it is.
Well, and we have an article about that too, so you can refer them to that. So parks without playgrounds, lots of different things. But anyway, so there is no one, basically, just to confirm, there is no one phase in which you will predict that the playgrounds will reopen.
Without just plain old being open without any other kind of restrictions, I don't see it until 5, okay. But who knows? I mean, I am not going to make predictions because every time I do, then something comes out, you know, different. So we just kind of have to play it as we go. But that's the theory behind it. That's what I would be most comfortable with. You know, I see lots and lots of kids out in the park and they are remaining safe. They're playing on blankets, they're playing with their own balls, they're playing with stuff they bring to the park. So I think that there's a lot, and we have a lot of really cool parks and places to fish, and, you know, maybe it'll be time for kids to try something new that they haven't done. But, you know, I know there's a lot of cool stuff to do. It's just got to be done differently.
Thank you.
Thank you.
Okay, thank you. That's the end of my list. So that'll conclude our questions for today. Just before we conclude the news briefing, a couple quick reminders. We are still updating our website daily with new information at champaigncountycovid19.org. The 211 service remains available for anyone who is seeking resources or needs help sorting through those. And also, I just want to put in a quick plug for the testing site at Marketplace Mall. I actually went out and got tested myself yesterday. It was super quick and easy. You do the test yourself. You only put the swab in 1 inch, so it's not, you know, the old test we were seeing where they were shoving the swab way back in your nose. It was completely painless. It was comfortable. So that is open from 8 a.m. to 4 p.m. every single day for anyone, or for most people who want to get tested. So check that out too. That's all I have. That'll conclude our news briefing for today. Thank you all very much.